I'm here to talk about, finally, after the introduction. So we saw that to reduce the occurrence of ASF or to change disease prevention behavior, because I told you it's human beings who are driving the disease spread in this third epidemiological cycle. So we saw that we need to move the focus from knowledge and technical solutions to context, and realize that knowledge is not the main driver of risk behavior for disease spread. There's been quite a few studies where you investigate the knowledge, and when you say that, oh, if we would just increase the knowledge, the behavior would change. And I like to use this example that we know a lot things we should not do and things we should do more, and generally we don't do it just by knowledge. It's not just only knowledge that will change the behavior. So we need to move focus from people to structures, and from blaming people for the decisions they make to try to instead to understand the rationale, and to realize that people do make rational choices based on the context that they are in. And I like to use this model by Ayako Ebata. It's from a paper which is called Why Behaviors Do Not Change. It's from discussing pig diseases in Myanmar, but it's very general, where she points out how the structural factors shape the disease prevention behavior. So basically the biosecurity behavior, their poverty, the low income and ill health, and the low productivity, and the small scaleness itself of a livestock production, then included the limited investments in disease control. So in biosecurity is shaping what people can do. So this was the basis of this study, where we wanted to use multidisciplinary research to improve African swine fever control in Uganda. So we wanted to use recent methodological developments to transform the current knowledge of ASF control and biosecurity, which is a lot by this, for example, the 58 publications that I found in the Google search, to transform this into successfully implemented biosecurity measures on farm and community level. And I write here community level because in Uganda, the pigs, they are free roaming. They are not, most of them, as you can see in the lowest picture there, they are not enclosed. So you have to look at the community or a village as the epidemiological unit. So even if we talk about biosecurity, which will be implemented by individuals with their own pigs, it's still a village or a community approach which is needed. So we specifically wanted to investigate the capacity for transformative change towards biosecurity using participatory action on community level, and specifically to have a broad inclusion of stakeholders from the entire smallholder pig value chain. There's been a lot of effort concentrating on farmers recently because it's the pigs or the farmers that die. So that's where we see maybe the biggest impact, even if we can see the impact all over the value chain, but we have to realize that the disease is spread all along the value chain. We also wanted to provide stakeholders with ownership of a disease problem and the control. But that was important because the states in many low-income countries will never sufficiently have the possibilities to invest in disease control. So if we want to change, it's important that stakeholders themselves feel that they own the disease problem and the control. And we wanted then to specifically test the feasibility of co-created community contracts for biosecurity. So, and these contracts, they look like this. A lot of listed measures, and then the tick there in the third column is what the people agreed, and then they all signed in each community. So we call this a participatory implementation study, and we can maybe discuss that a bit in the Q&A session, the difference between co-creation, participation, and implementation. If I just quickly mention here that when you talk about participatory research, then we mean that the participants themselves define the problem and the solution. An implementation study, it can be that you either the participants or the researchers come up with a solution, and then you test it, how to best implement it. And co-creation, it's somewhere in between, where you together co-create a solution for a problem. So this is what we did here. So we selected 6 villages from 3 districts in the Gulu region in the north of Uganda. And these were purposely selected because we knew that they had African swine fever before, and that there was different stakeholders in the pig value chain present in each district. And then we purposely also selected the participants to have the different stakeholders and to have both men and women. And then we did a longitudinal study design with several interviews revolving around this co-created community contract. So in the first meeting, we presented African swine fever, what it was, and gave out a poster with showing how it spread and how we can prevent it. Together with both, with different stakeholders, so farmers and all the others, which I will from now on call traders. So that is middlemen and traders and butchers and people that sell fresh and cooked pork. So we separated them, and then we presented biosecurity measures that we suggested and discussed them all, and the people decided if they wanted to try to do something new for 1 year, and then it would follow them. And then we created together this community contract, agreeing what to do in each village. And then we followed up first after 4 months, where we talked to farmers in a group and the traders individual, and then to each traders their place of business to discuss if they had done some changes and to support and coach them. So we discussed about the implementation, about the measure, how it was, and the actual contract as such, and the cooperation in the village specifically. And in the second follow-up, we had an open meeting so that everybody in the village that was interested could come, and we gave the same information as in the first meeting, handed out the poster, and then interviewed the original participants again about the implementation, about the contract, about the cooperation, and also about COVID, which had happened during this time, unfortunately, how that had affected the implementation. And then it could look like this, a very busy slide. To the left is all the different measures, and then you have 6 villages, A to F, and the 3 meetings or interview times. So at the first time already, we asked what they already did, because we didn't want them to select for their contract things that they already did. We wanted to investigate the capacity of change. So the gray squares here are things that each village were already doing, and this is on village level. So it's a fist that one person say, I'm already doing that, and then it would be gray. And you can see that this is villages in which might look quite similar from the outside, but they do already different things. And then they selected what to do. So that's the colored squares now. And then at the first follow-up, green is measured as what's selected and successfully implemented. Red, unsuccessful, selected but not implemented. And yellow, something in between. It could be that it was some had succeeded and some not, or that it was not relevant because they maybe didn't buy any pigs, for example, during this time. And then we see then for a third follow-up, but yeah, the same with the colors. And then we also had just a quick score if it was easy or difficult. So that's the E and the D, and the N for not applicable, something in between. Again. And we can see it's more green. So to follow up seems to promote implementation. And this is all only, it's not, it's just on reports, participants on reports of how the implementation was going. And just want to point out some of the few measures here, which I find interesting. The first one here, use only my own boar. It's something that is very frequently recommended, but you should not use village boars. It might spread ASF. And this, only one group chose that measure, and it was not successfully implemented. And yeah, so this is something that is in these circumstances necessary if you want to have pigs. Then we need to discuss other solutions which came up, like to isolate the boar when it comes back, or only lend out the boar to someone that you know have good biosecurity, for example. And another very important measure, of course, to remove carcasses of dead animals and aborted feces from the pigs and discharge of them safely. This is very important, and three groups chose it, but only one managed. And this was discussed very lively, and there was a lot of discussion about this. But the social taboo of throwing away, so not eating important protein, and also the burying as such, but it's either it takes a lot of labor, and in some of these villages, it was a social taboo to bury other living things than humans. And if you burn them, for example, it takes fuel, which is expensive. So this was also something that we frequently recommend, but that we cannot recommend without discussing it. It's for some, we had a bigger discussion, and then we came to a solution that, yeah, we will try, or that some aspects of safe burial was possible, but not others. So we can not just suggest it without discussing. Another interesting thing is that all groups wanted to have a group, a farmer or village group with common standards for pig keeping. It was very popular, so we can already see that this community approach is already there from the beginning. But because of COVID, no one succeeded without, or yeah, maybe because of COVID, but also because of other things, maybe needed a bit of facilitation. So that we helped with between the first and the second to help create these groups, and then it seemed to work. So we can already see here that groups that appear homogeneous for the outside researchers makes very different biosecurity choices. So there's layers of diversity and heterogeneity. And we also see the diversity of selected measures, which shows us the complexity in smallholder farmings. And this slide is to illustrate what then we discussed both why a measure was selected to be included and what facilitated the implementation. And we saw that feasibility, it's very important, and the opposite, lack of feasibility will hinder the implementation. It needs to be easy, it needs to be something that is readily available, and that doesn't take too much effort in otherwise very busy smallholder lives. The knowledge which the participants gained from the first meeting where we discussed about the disease helped implementation. And also, very importantly, the community approach, that both sides of, for example, a transaction, so the seller and the buyer of a pig, they both had heard that you should not enter into the farm, but you should take the pig out to look at it, for example. Hindering implementations of lack of feasibility, also costs or losses. So like to, for example, not sell meat of a pig that is sick or that have died. Or very small costs as well, like change of boots when you go into the pigs, or change of clothes between different customers if you're a trader. This was hindering, like, yeah, I only have one pair of coveralls, for example. And the social norms together with the burials or throwing maybe meat, which we discussed. Also noted that some measures were uniformly rejected, like the not to use boars. So it really brings up if we don't have enough understanding for the local context, despite our long experience in this area and the stakeholder dialogue that we had before. Also interesting to note that some very basic biosecurity measures were not previously known to prevent disease, even in an area where I know there's been a lot of information, and there's been outbreaks, and there's been a lot of interventions from the district veterinarians, for example. But when you discussed, these were considered feasible and they were implemented with success. Example for confining pigs and hand hygiene, the very simplest. Change of clothes and footwear, separating healthy and sick pigs, not feeding swill, and having separate equipment at slaughter and at home, for example. So just the fact to sit down and discuss helped implement these very simple things. And this is my almost last slide. So summarizing, participants described how they shared their knowledge and informed others about biosecurity. There was a positive attitude to the agreed measures and the strategy in the contract. And it was important, or it would have been important, to include the entire community or let community members choose themselves if they want to participate, because we did now a selection on village level in order to facilitate our group size, but this was not ideal because some people felt left out and they asked, why am my neighbor involved and not me? So this co-created community contract, they instigated biosecurity changes. That's our conclusion. They supported cooperation, created knowledge, which led to empowerment, and it's inspired the peers. And this led to the changes we saw. Participation, co-creation, the local adaptation of the measures, the option to reject that we presented this list, and people could say, no, this one I don't want to do, that one neither, and then choose what to do. And the community approach seemed to stimulate the change. The contract as such goes beyond the paper. Many people told, I didn't need the paper. I had the knowledge with me and I could talk to my neighbor. It was also important to create a safe and a neutral venue for stakeholders to meet and talk to each other. Even if these people lived in the same village, the farmers might already, for quite few of them, already had like a farmers group, or maybe farmers groups for other issues like a chicken group or a cattle group. But they didn't, and so they already knew each other and they talked, but it's not so common for the butcher, for example, and the farmers to sit together and talk. So that was important. And the positive peer pressure, if you call it like that, the social control that everybody has sat together and agreed. If you want to read more, there's 2 studies published from this. The first one describing the methodology, and the second one more discussing the biosecurity measures. And that would have been my last slide, but now I added one more here. I just want to mention that this way of working, it's very well in line with the regional strategy for the control of African swine fever in Africa, which is being updated. So the joint document of FAO, AO, IBAR, ILRI, and WOHA, where the control is described as having 3 thematic areas, so prevention and control, including biosecurity, and then also the institutional capacity and sustainable pig production. And these 3 thematic areas, each based on 3 fundamental principles, where participatory engagement is one of them, including that the control need to increase ownership of any disease control, and the value chain approach. So you can keep your eyes open for this strategy. It's coming to you soon. And by that, I just would like to thank the funding agency, which is the Swedish Research Council, and my colleagues in Gule University and the Swedish University of Agricultural Sciences and Makerere University as well. The study participants, of course, translators, facilitators, and mobilizers. And that was it. And then just if you have any, now we have time to discuss, but if you have any questions after that, you can contact me on this address here or through the PMP-TAB Secretariat, of course. Thank you very much. Now I will stop sharing that I can see you a bit more.